Each time I went to another doctor, they gave me a false hope or a belief in that what they provided was going to be the answer.
So many of my patients have grown up in environments where everybody was doing their best, and they may not have done things in an ideal way, let's put it that way, but when you understand what they were coping with, then you understand that they were probably just doing their best.
I started realizing that the pain changed. And that was my first aha moment that these symptoms were not physical.
Welcome to The Story Behind the Symptoms, a podcast from symptomatic.me. Your host is David Clark, MD, a board-certified gastroenterologist who successfully diagnosed and treated over 7,000 patients with neuroplastic pain or illness. Each episode, we dive into our guests' life experiences to uncover the deeper causes of their symptoms. By listening to their story, you will gain insights that advance your own journey towards knowledge that becomes healing.
Hello, and welcome to the Story Behind the Symptoms podcast. I am your host, Dr. David Clark, board-certified internist and gastroenterologist, and president of the Association for the Treatment of Neuroplastic Symptoms. And what we do in this podcast is we talk to people who have had neuroplastic symptoms, or in some cases are still having them, and try to understand the story behind it, to understand where those symptoms came from, much as I did in my office for many years. My guest today is Laura Haraka. And Laura, why don't you introduce yourself?
Sure. My name is Laura Haraka. I am a somatic experiencing practitioner. I'm a breathwork facilitator and a mind-body coach. And I'm the owner of Feel to Heal Wellness, where I empower people to utilize their own innate healing capabilities through their body, through their breath, to free themselves of a life of chronic symptoms. I'm the host of Beyond the Pelvis podcast as well.
Okay, that's great. No, we need as many people sharing this information as we can get, as you very well know. Well, we are going to talk today about a symptom that doesn't get nearly the attention that it deserves. In fact, a whole bunch of symptoms that don't get nearly the attention that they deserve. And it's a real indication of the power of the neuroplastic process to produce virtually any kind of symptom, virtually anywhere in the body, and to do so at potentially severe levels. And the common denominator of all these symptoms is that there's no structural damage or organ disease to explain it, and consequently, most healthcare professionals, physicians or mental health professionals, are really challenged to try to understand what's going on and how to help. And Laura has been through all of this, and why don't we start where I always do, which is when and where did the symptoms begin, and what were the symptoms, and what has been their course over time?
Sure. So my day started out like any other day. I was just a stay-at-home mom, and I was the PTA president for my two daughters' elementary school. And it was May 2nd, 2015. I had taken my kids to school, taken them run in the park, came home, showered, used the bathroom. And a few moments later, I had to use the bathroom again. And at that moment, I knew something was totally wrong. I thought I had a UTI, but to be honest, I never had one before in my entire life. So I said, UTI, let's grab a yogurt, grab some cranberry juice, go on my way, it'll probably pass. So when it didn't, I went to my primary care doctor, hoping I'd say, just give me some antibiotics, I'll be on my way. Well, when they did the test showed that there was no infection at all, but I was still in tremendous pain. So he sent me home and said, if it gets worse, go to a urologist. So over time, the pain got worse. I was in extreme pain. I remember vividly the next day sitting in a tub, absolutely terrified and crying. And I had my phone with me and I started Googling symptoms. And I didn't even think that I can type in the Google what was happening in my brain. I felt aroused and I didn't understand. There was no sexual arousal happening for me at the time. I was just starting my day. That's it. So I typed in, I feel arousal, and it came up. And that there was a symptom called PGAD. persistent genital arousal disorder. And I just started crying. I had no idea what to do. I felt completely isolated. Who do you tell about this? I didn't even want to tell my husband at the time. I was embarrassed. I was mortified. I was even second guessing myself that I really was feeling this. So when I realized that this was an actual condition, I went on a 4-year quest to figure out what was wrong with me and to find relief. I went to over 25 doctors across the United States.
Oh my goodness.
Yeah. I literally got on planes and traveled to them. I traveled to Texas. I traveled to Washington, D.C. I traveled to Tennessee. I had consults with doctors in California. There was a doctor in, I believe, Montana. I went all over trying to find help. And I was given 10 different diagnoses, 10, all under the umbrella of pelvic pain. Because I have to say, the pain morphed. It changed over time. But I still had the arousal, which was probably the most distressing of all the sensations in my pelvic region. I had multiple tests and procedures, and I could even tell you some of the tests I've had: bladder installations, cystoscopies, urodynamic studies, Botox injections, iliolingual injections, trigger point injections, and I even had an embolization of my ovarian veins. Yeah. It was a really rough, traumatic point in my life. Things were completely bleak. It was definitely a time of despair. And then there was the loneliness. How do I tell people I feel aroused? How do I even tell a doctor? It's not an easy thing to do.
And it also, it's not a pain symptom. When we doctors, we know what causes pain. It's structural damage or it's organ disease. Those are the things we're trained to look for. And then someone comes into the office who is telling us that pain is only part of it and that you have this arousal symptom. And, one of the characteristics of this, people are going to wonder, is, does a sexual climax alleviate the problem? And for most women, it does not. And if it does, it's only temporary. So that doesn't explain it. So what in the world could possibly be producing something like this? The test that you've had, you're not going to have a tumor in there. You're not going to have inflammation that escapes this. Structural damage is going to be detected by the evaluation that you've had. So essentially no explanation is going to be found for this part of it, or for the pain either, for that matter. And that leaves most healthcare professionals at a loss. If there's not organ disease or structural damage, most healthcare professionals, myself included in the early days, don't know what to do next, don't know how to evaluate somebody for this. And the diagnoses that people get can be all over the map. Doctors will try, they will assume that you have some kind of structural cause for this, some kind of organ disease, and they will try to put a label on you that is the best fit that they know for the symptoms that you have, because they're not aware that 40% of people who come into a primary care doctor's office have a neuroplastic symptom, have a symptom that's actually generated by the brain. But the idea that a symptom like this could be brain generated, especially since until lately it hasn't been talked about. I only found out about this, the PGAD, when I was asked to give a 5-hour presentation to the International Pelvic Pain Society a few years ago. And I, had to do background research to be sure I was prepared for the talk, and found out that, in round numbers, something like 1 person in 60, and it can be men as well, 1 person in 60 suffers from PGAD, which is an astounding number of people. In the adult population, we're talking about 3-4 million people. And of course, they're going to have the same experience that you did. They're not going to want to talk about this very readily, even with their doctors, so that the potential is there that even more people than the surveys show are suffering from this, just because people don't want to mention it. All right. Usually I don't interrupt people in the middle, but for the purposes of the podcast, I do that. If I was in my own office, I usually just sit, be quiet, and let somebody tell their entire story. So please pick up where we left off and let's go on.
Yeah, sure. And I want to add, if it's okay. Yeah. So when I first started talking about PGAD, I would just say it on a podcast. I wouldn't go into details. And I really think it helps people not to feel alone if they can understand how this shows up in the body or how it can show up in the body. And for me, it showed up in multiple ways. So first of all, it showed up as clitoral arousal. And that can feel extremely strong at times, and it can actually turn into pain. And then it can also show up deep in the vagina. And it feels like a deep arousal. And it's almost like having an itch that you completely cannot scratch. And it becomes extremely distressing. And it can last for hours, days, or it can come and go. So it varies from person to person. It can also show up rectally. And rectally, it showed up for me as like a tingling and an arousal type feeling. And I want to say that on your podcast today. I know maybe it could be TMI, but I really want people to not feel alone in this diagnosis, that they're not crazy. They're not weird. This is a normal biological sensation, the same way you would get another sensation in your body, but it's happening in a very vulnerable, private part of your body that can make it more distressing and hard to talk about.
Yeah, absolutely. And people can just imagine trying to go through your day when you're experiencing this situation. I mean, we've all got obligations and things we need to get done, and trying to get those things done while you're experiencing this situation is going to be darn near impossible at times. And there's no such thing as too much information when it comes to this condition, because nobody's talking about it. It needs to be brought into public awareness just because of the sheer numbers of people that are suffering from it, and probably a lot of them suffering in silence and isolation. So this is going to be a big step toward broadening public awareness and getting people the help that they need. And it's also, I said this at the beginning, but I want to emphasize that it's a measure of the ability of the brain to cause such a wide range of symptoms in such a wide range of places in the body. And so that everybody who's a healthcare professional who encounters somebody with a symptom that doesn't have a clear-cut biomedical explanation immediately should be thinking about, could this be neuroplastic? And start an evaluation for the patient to find out, what are the issues that might be responsible for this? Because you can't have a significant symptom in the body that is neuroplastic without there being a pretty powerful cause behind it. And it's just a question of finding out what that powerful cause is. And I just want to mention a couple other concepts that just are examples of the power of the brain to affect people. One of them was a patient of mine who had a completely paralyzed stomach, not the abdomen, but the organ of digestion. It was not contracting at all. That was purely brain to body, because when the powerful underlying stress issue was found and addressed, his stomach went back to normal. Other patients I've talked about frequently, just as extreme examples: patient with 79 years of abdominal pain, patient with 55 years of abdominal pain, patient who was averaging one bowel movement per month, and a patient whom I was asked to see in the hospital on her 70th day, getting morphine around the clock for unexplained abdominal pain. Every single one of these patients I'm describing was successfully treated by uncovering the underlying stress issue. And I mentioned them just to show the range and the severity of symptoms that the brain can produce. Persistent genital arousal disorder is another one, and it can be accompanied by symptoms elsewhere in the pelvis. And I think you had those as well, unfortunately.
Yes, I had overactive bladder. I had pelvic floor dysfunction. I was diagnosed with pudendal neuralgia, interstitial cystitis, pelvic congestion syndrome. That's what I had the surgery for. I had a slight hernia, a herniated disc, and Tarlov cysts, and last but not least, endometriosis. Talk about a wild goose chase that I was on for a few years there.
Yeah, we as physicians, we are taught, if there is a symptom going on, there's got to be a physical explanation going on for it. And we're going to give you the label that best fits your symptoms, even if it's incorrect. Because as far as most of us were trained, there's no other possibility, except for maybe a few neurotic people who can't handle their own life stress and who develop these imaginary symptoms that are all in their head, and we can't diagnose you and we can't treat you, and you're just going to have to live with it. And please go away because we can't help you. And that is the attitude that a lot of patients encounter. But it turns out every single one of those assumptions is false, and for most of them, the opposite is true. My patients who have this are actually quite strong mentally, psychologically. They're just having to carry a burden of stress that is usually well beyond what even they themselves recognize. And they are absolutely able to be diagnosed if you know what to look for, and they can be treated as successfully as anybody else. In some cases, more successfully than other people. We don't cure diabetes, cancer, or heart disease very often as physicians, but for neuroplastic symptoms, we absolutely can treat people successfully. And you're living proof, as are many other people that have been on this podcast.
And just to reiterate what you said before, there was no relief. Having sex by myself, masturbating, or having sex with my husband was not going to alleviate the symptoms. It was exactly the opposite for me. It actually made things worse.
Yeah, and that tells you that whatever is going on is not connected to normal physiology. And again, that should be a giant screaming clue that we need to look for abnormal physiology, which is what neuroplastic symptoms are all about. There are real changes in the neuroanatomic pathways in the brain that have been seen on functional magnetic resonance imaging. Not in this case, it hasn't been studied by that method, but in other cases, fibromyalgia, somatization disorder, and some others. But there are real physical underpinnings to this that represent a physiology that is not part of the normal range, and that comes about because of stress, emotions, trauma, other challenges in life that, when identified and addressed, the physiology can go back to where it's supposed to be. There's a case report in an irritable bowel patient that showed that, and of course the Boulder back pain study published in JAMA Psychiatry in September of 2021 also scanned the brains of people before and after treatment and showed anatomic changes. So we've got, this is not in people's heads, it's in their brains, and we can diagnose and treat it successfully. Okay, let us carry on with where things went from there.
Yeah, so I went to all these doctors, and I will say, not one doctor asked me what was going on in my life at the time. Not one. Actually, I was told the opposite. I was told I was crazy, there was something wrong with me, and I needed to see a psychiatrist. And that made me feel even worse.
Yeah, of course it did. I mean, it's putting the blame on the patient. The implication that many of us in our medical training learned that if you do have this symptom, it's because you are mentally or psychologically deficient or ill in some way.
Yeah.
Which is not the case.
Right, exactly. So I left my family and I started traveling to all different doctors all over the country. And a rising guilt and sadness was coming in me because I had such a disconnection from my family, my friends, and my children. And each time I went to another doctor, they gave me a false hope or a belief in that what they provided was going to be the answer. But what they did give me was oxycodone, Klonopin, gabapentin, antidepressants, trazodone, and I became addicted to multiple medications.
Yeah, once again, my profession is getting indicted here for treating the symptoms rather than the cause.
Yeah. So along with this addiction that I developed clinical depression, anxiety, and suicidal ideation. I was literally out of my mind. It was like I wanted to rip my eyes out, and there was nothing I could do. So things were looking extremely bleak for me. I didn't know where to turn, and I didn't have many people to talk to. Then it all changed. In 2017, I met a hypnotherapist in New Jersey, Caitlin Peterson, and I didn't know it then, but that would be the turning point of my healing journey. She provided a safe place for me to share. Since Caitlin's office was down a long hallway. And one day while I was waiting for her, I heard the door open to the building that she was in and her coming up the stairs. And all of a sudden, she peeks down the hallway, sees me sitting there, and jumps back. And all of a sudden, on her cell phone, she starts blasting dance music. And she starts boogieing down this long hallway. Well, I had no idea what to do. I didn't know if I should smile. I didn't know if I should look up. I had no idea what her intention was with this. And she did this for months. Now, I knew her birthday was coming up, and I was so grateful that she was just trying to make me find joy in my life. And we've talked about this, the missing component in neuroplastic pain people are lack of joy. So she was trying to give me a sense of joy in my life. So I decided to go home and start learning the steps to the Mandisa dance, Good Morning. And I enlisted my 2 kids, and I didn't have a great relationship with them because of the pain. And I said, will you please help me? And we practiced the steps to the Mandisa song for 3 months. And you say, why does 3 months matter? Well, I'll be honest with you, Dr. Clark, I'm just a terrible dancer. And it took me a really long time.
You and me both.
To learn the steps of the dance. But when I did, I started realizing that the pain changed. And that was my first aha moment that these symptoms were not physical, that there was a neuroplastic component. And I didn't know it then, but I was creating new neural pathways in my brain. And I had never even heard the word neural pathway before in my life. So I was finding joy, and through repetition and with practice, I was learning the new steps to a dance. And I will tell you, I did dance down that hallway for Caitlin. And I continued to see her, and I continued to dance because it was helping my symptoms.
Yeah, it's a astonishingly common issue for my patients that they are the kinds of people that are continually working on behalf of others. They are taking care of their spouse, their kids, their workplace, their neighbors, always focused on the needs of others, and to the point where they fail to put themselves on the list of people they take care of. When I ask them, what do you do for fun? They have trouble coming up with much. And sometimes what they do for fun is really much more goal-oriented than it is joy-oriented. And not having that ability to take time out for your own self-care, for your own joy, that's an essential human skill. And if you don't have that, you are going to be living a life as if on a treadmill you never get off. And sooner or later, your body is going to protest one way or another. So would you say, going into this before you acquired this condition in 2015, that you were living a lifestyle that resembled that in some way?
Absolutely. There was a few things. Number one, I was living in an unhealthy marriage. Number two, my nephew had a kidney transplant at the same time my daughter was born. He was 2 at the time. So I was helping them considerably. When I tell you helping them, I learned how to hook up J tubes and G tubes. I am not a doctor. And I learned a lot of medical skills during that time.
And you had a newborn.
I had a newborn plus a 3-year-old. And then 2 years later, my sister fell down a set of stairs and shattered her femur. And I had her 1.5-year-old son come live with me. So talk about a lot of stress that I had in my life. And I will tell you, there was no self-care. I was helping my brother's family, cooking for them too. I was helping my sister's family, watching her son. And I also had my own kids and a pretty disgruntled husband at the time. And I'm saying that on purpose for a reason, to show the symbolic part of this PGAD.
Yeah, it's the very definition of not sustainable, what you're describing.
Yeah, totally unsustainable.
So I love the dancing. Did you add other things to your life that had no purpose but your own joy? Because that's so important.
Well, not yet. I didn't make the connection yet. I just thought, dancing, my pain's getting a little better, but I still wasn't great, to be honest with you. I was still addicted to lots of medications and I was still in a lot of pain. So I went to see, and I believe you know her too, Wendy Newman, who is a somatic experiencing practitioner in New Jersey. And somatics, for your listeners that don't know what it is, it's an alternate form of therapy to treat trauma and stress related disorders in the body. And there is a difference between somatic experiencing and somatic tracking. They're both great modalities, but people sometimes don't understand that there is a difference between the two, where somatic tracking is more mindfulness based technique used in pain reprocessing therapy. And I use that as well to help me heal myself. And basically, it's helping reduce fear and rewiring the brain's perception of pain. But the goal of somatic experiencing is also to restore nervous system regulation and resolve trauma at a physiological level.
Okay.
Yeah.
Did you, we talk about this frequently in the podcast about people's experiences when they were young and how that played out into the way that they experienced stress or trauma as adults. Was there any of that in your history?
Absolutely. Well, I grew up in a house where my father yelled a lot. I know it now that he probably had so much anxiety and there was so much survival energy in his body. It came out in screaming. And it was really scary to live in that house. And my grandmother was very sick and lived with us at the time. So that created a lot of stress on my mom. My brother had a kidney issue. So he was in and out of the hospital having multiple surgeries. And my sister had osteomyelitis, which is a bone condition, a bone infection.
Yeah.
And we had nurses coming into the house constantly with IV for her and antibiotics. So the household that I lived in was not easy. And it was really no one to blame that my brother had a kidney infection, kidney disease, and my sister had a bone infection. But if you can think about it, I probably didn't get the attention that I needed at the time. Yeah. I was trying to help people.
That is a key statement because a child in an environment like that, and let me back up for a minute and just say that so many of my patients have grown up in environments where everybody was doing their best.
Yeah.
And they may not have done things in an ideal way, let's put it that way, but when you understand what they were coping with, then you understand that they were probably just doing their best, but nevertheless creating an environment that would have been hugely challenging for a child such as yourself, who would have reacted to that environment by trying to fix everything, by trying to focus on the needs and the needs were substantial of everybody in that household. And when you are so focused on that, plus the father's outbursts are going to create an environment that resembles a minefield where, some days you can wander through the field and everything is fine, and other days you wander through the same field and something blows up. And because of that, you have to be constantly vigilant and watchful. And a child in that environment is typically going to try to make things better so that dad doesn't blow up quite as often. And all of that is taking attention away from yourself and putting it on everybody else. And it is teaching you that it is your job to fix everybody else's problems, which is exactly what you did as an adult. And the idea that, hey, you know what, when you're a 6-year-old girl, you should be spending a large chunk of your day enjoying yourself, just learning how to play or just, doing whatever seems like fun. Because when children play, they are learning self-care skills. They are, in effect, learning how to dance. And if you don't learn that, then as an adult, it is going to feel like the most natural thing in the world to be taking care of everybody else's issues. It is also going to be the most natural thing in the world to form a close, personal, romantic partnership with somebody who has issues or needs a lot of support. And so those relationships, especially when people are younger, often turn out to be unbalanced, where one side of it is giving a lot more than they are getting back.
Right.
And that's part of the unsustainability. So does this sound like it's a reasonable impression of what you were coping with?
Absolutely. I learned to fix things. And I even became a parent that tried to fix things. And I didn't learn how this developed till I did my own training and realized how these develop from, our childhood. So now that I realize it as an adult and having two adult children now, I realize when that fixing part of me wants to come out and I notice it, I'm aware of it, I acknowledge it that it's not my fault, and then I take another action. I take a breath and I listen, because I don't always have to fix everything, because all it did was take me out of taking care of myself and my own self-care in my life.
You are able to put yourself on the list of people you take care of.
Yeah, it's actually a priority for me. So even in my day today, I had a client, I had my group, I have this podcast, and I carved out time later this afternoon for me. Even if it's just to sit with my feet on the grass and look at some birds, because I've learned that self-care is one of the most important things we need in our life, because I don't want to go back into the existence that I had before of not taking care of myself. It's just too important.
Yeah, no, it's huge, and it was something that I always asked my patients about, their ability to do self-care. As long as we're talking about life when you were a kid, I think our viewers are going to want to know if you experienced any form of abuse involving your pelvic region anywhere along the way.
Yeah, that's a good question, because I have a lot of clients with pelvic pain, and some of them do have abuse. I did not have any physical abuse. There was no rape. There was no abusive boyfriends. I wasn't coerced to have any sexual relationships when I didn't want them. So there was none. There was only, I would say, verbal abuses in my life.
Okay, well, that's important because so many women with pelvic symptoms did experience that. One of the early studies from 1988 found that the rate of sexual abuse of women with pelvic pain was 3 times higher than the general population. So it's definitely something important to ask about. So in addition to the idea of self-care, what were some other concepts that you found particularly helpful in alleviating your symptoms?
So when I saw Wendy, like I said, she's an SEP, and it was somatic experiencing practitioner, I learned that there are other sensations in my body besides my pain. This was just a part of what I was experiencing. It's not who I am. It's just a part of what my body was experiencing. And I say that on purpose because, people start, connecting their symptoms with who they are. And it's just a biological response or physiological response my body was having. So Wendy taught me to lean into positive sensations. And one of the things that we did together was I started just literally taking my hand and letting it hang in front of me, being supported by my elbow, and started connecting to my hand, noticing how it feels, noticing the weight, noticing if there's any tingling or numbness coming up as I was doing that. And it's funny, a moment ago, before I put my hands up in the air right now, I didn't even pay attention to the fact that I had a hand attached to my body. So I learned to start connecting to other parts of my body that felt good. So I started doing it with my hand. I started doing it with my feet. And to be honest, I would spend hours just sitting, noticing my feet. And my feet would start having sensations. And when that happened, the pain started going down, which was amazing to me. And the other thing that I started doing was paying attention to my emotions. I would literally just sit and ask myself, what am I feeling?
Yeah, that, when you're growing up in that environment that you described, your own feelings need to get repressed because in order to survive in that environment, in order to stay focused on solving the problems of the other people in that environment, making that environment more successful in every way that you possibly can, the emotions are not going to help you in that situation. So they end up getting stuffed. And later on in life, when emotions are knocking on the door, you've gotten very good at stuffing them as a kid. And so they get stuffed again as an adult. And the emotions still are getting expressed. They're just expressing themselves via the body. Most of the emotions, especially the negative ones, have a physical component to them. But when people have been through experiences like this, the conscious part of the emotion is not there, but the physical part of the emotion is still there. And that just confuses people. It's like, what is happening in my body here? Because they can't say, oh, I'm angry, or oh, I'm afraid, or oh, I'm ashamed. They're not feeling those emotions. They're just feeling what's happening in the body. So that's a tremendous insight that you had to start paying attention to your own emotions. And it's a form of self-care. It is sending a message to yourself that you matter.
Exactly. So I literally just sat and I'd give myself about 15, 20 minutes and I would sit and just say, what am I feeling? And if nothing came up, I would say to myself, do I feel angry? Is there anything that made me angry today? Is there anything that made me sad today? Is there anything that made me jealous, guilty? Whatever the feeling was, I would just kind of go through a gamut of different feelings. And I would allow them to rise in my body. I would be with them. And one of the things I do when I teach people through somatics is I would say hello to them. I'd acknowledge them and I'd put my hand on them. Maybe if it was my chest, my belly, wherever I needed support, not to get rid of them, but to give my body support to allow them to move through me.
They have a right to be there after all. Emotions are not good, bad, right, wrong. They just are.
Yeah, all of them. And they all have a purpose. And we all have this, or some of us have a belief that emotions are bad. Like crying might make me look weak, right? But it's coming to the truth that crying really has a great purpose. It helps the body let go and it helps let go of cortisol. So I had to change my belief system that emotions are good. And I will tell you, when I did this process, and I did it every single day, and to be honest with you, I still do it. I still make time to do it. I would sit with it, allow it to pass through me, but then I'd end with joy. What brought me joy today? And I'd allow the joy to fill my body. I'd allow myself to smile, and I would embody the happiness. So I started really making a connection with my emotions. And if there was tears, I allowed them. If there was anger, I would allow that impulse to happen. Maybe I needed to push my hands together to feel the anger. Maybe I needed to push against a wall. One of the practices I do with my clients now is we twist a dish towel to get rid of the anger. So, and I still do it today. Whatever impulse is coming up, I allow it to be fulfilled and completed.
Yeah, it's, everybody needs to be able to have this ability to feel their own emotions. Mm-hmm. And again, that if you are not able to do that, then sooner or later they will express themselves in some other way, usually via the body. But what you're doing also has another benefit of affirming your own value as a human being. So many of my patients who grew up in challenging home environments, they weren't able as kids to solve all the problems in those homes, of course. And when they failed to solve the problems, they felt like second-rate human beings. or in some cases, more extreme cases, they felt worthless. And doing this with your emotions as an adult is a way of affirming that no, you are not worthless. No, you are not a second-rate human being. Yes, you are absolutely worthy of having these emotional experiences. And that worthiness, that sense that you are just as valuable a human being as anybody else, is an essential foundation for further healing.
Yeah, we want to feel all of life. We're entitled to feel all of our emotions. It's part of the living experience, the human experience. So I read you a list of symptoms before, and I always have them written down because I forget there was so many. I have not had another UTI since 2015. Well, it wasn't even a UTI, the symptoms of a UTI. I do not have pelvic floor dysfunction. I do not have PN, pudendal neuralgia. I trained myself how to ride a bike before the internet even these things were coming on. I just showed myself it was safe. And so I have never had another symptom of pudendal neuralgia. I can eat anything I want and drink anything I want. Obviously, with balance, we should always have balance in life. So I do not have one symptom of IC. I do not believe I have any endometriosis symptoms. The Tarlov cysts do not bother me. And I do not have overactive bladder. Every once in a blue moon, I will get a twinge of an arousal symptom every once in a blue moon. And what I do then is I go to my body and I say to myself, did I not give myself enough self-care today? What didn't I feel? And once I do that, it can last seconds.
So you are doing what I recommend for a lot of for pretty much all of my neuroplastic symptom patients, which is to use the physical symptoms when they crop up as a form of communication. That your mind is trying to tell you something. It was trying to tell you something back when you were in the middle of the most severe episodes, but now you can understand the kinds of things that it is trying to communicate and use that to understand what's happening internally.
Yeah, because we can't get rid of pain altogether from our bodies. We want pain in our lives, right? And if we look at pain as a messenger, it can really help us to stay balanced. So I really believe, and I teach my clients to have a maintenance plan. When someone goes to Weight Watchers and loses, let's say, 30 pounds, if they go back to doing what they were doing in the beginning and eating whatever chocolate cake or eating unhealthy, they're going to gain that weight back. So that's why every day I sit with my emotions, I sit with what I'm feeling, and I give myself time for self-care. Because everybody has a headache every once in a while. It happens in life. Everybody gets a stomach ache. These things happen. It's okay to get a twinge somewhere in your body every once in a while. We just don't have to have it chronically.
Yeah, and it's telling you that it's time to step off the treadmill of taking care of everybody else, and just to tell everybody else, you're on the shelf for a little while here, and I'm going to focus on myself.
Exactly. So looking at pain as a messenger can be extremely helpful. And it also, you don't fear it as much if you look at it as a messenger. And I'm so grateful for all the work that you have done and all the other practitioners out there, because if it wasn't for that, I wouldn't have found this world and healed my chronic pain.
Yeah. Well, Laura, I am so grateful for the incredibly clear and honest and forthright explanation of this entire journey that you have been on. Certainly just horrendous in the early years, but there are going to be many viewers of this who have never heard these concepts before and who are going to benefit tremendously from your story. Is there anything else that you would like to share with our viewers, or any questions that you have for me?
Sure. I can tell you the one thing I really learned on this journey, and not just the pain journey, the journey of life, right, is healing isn't something we're meant to do alone. The most important thing I received and what truly carried me through was support. The people that stood by me, who reminded me of my strength when I forgot, who simply held space for me. on all the hard days. They were everything. So anyone that's listening, if you're in it right now, I hope you know you don't have to carry this all by yourself. There's so much power in letting yourself be supported, and there's so much love waiting for you along the way. It's one of the reasons I created my group coaching program, the Pelvic Healing Circle. So I have people come on live calls and then they can ask me anything. My body teachings, we do somatics and breath work just so that they're not alone in their pelvic pain.
Yeah, and I'm so grateful that you are joining us in spreading the word about this approach. I look forward to the day when every healthcare professional and every member of the general public knows that the brain can do this to the body. And then when doctors are struggling to find an organ disease or structural damage, they will know that there's another alternative that they can investigate that is treatable, that happens to people who are at least as mentally strong as the rest of the population. And that's going to absolutely transform the care of 50 million Americans in the United States alone. And you're contributing to that, and I'm very grateful. Thank you so much.
Yeah, thank you so much for having me here. Hopefully my story helps someone that's listening.